All right, we're going to be going through the manual muscle test for the internal abdominal oblique. So we have our person in supine. Again, I'm just going to go through the actions one more time that this muscle does some ipsilateral rotation, some lateral flexion, as well as flexion of the trunk. We're really going to focus on the upper torso and rib actions for this muscle. So I'm just going to go through the actions with my partner one more time. Basically, he's going to try to slide his hand down along the table, and then he's going to lift up and rotate towards that side. So those are the three actions that he's going to go through by himself for the active range of motion. So whenever you're ready, you can go through that for me. Excellent. And come back down. So this time, let's going to do one nice kind of smooth motion. You're going to slide and rotate. That looks a little bit better. Okay, let's do that one more time for us. Give him his workout of the day here today. Excellent. Okay, so for the AROM, just making sure that they're going through the correct actions, that you're seeing what you want from the muscle. And in this time now, I'm going to be doing the break test component of it. So I'm going to have him lift and rotate a little bit. So I'm going opposite shoulder and hip as I'm going to try to push that shoulder back down towards the table. 4, 3, 2, and 1, and relax. Excellent. And now stabilizing the shoulder and then opposite hip, and go ahead and rotate and lift up, 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 up into that motion. And again, we're seeing a little bit of shaking within that, which again falls normal. So it usually fits within that 4 to a 4+ range, depending on how you feel about their strength. So just a couple seconds, we're going to be turning him over to prone to go through the length of the internal oblique. All right, we've turned our person over into the prone position, and we're now going to be lengthening this right internal abdominal oblique. So for that, I'm just going to verbalize those actions one more time. It did flexion, it did lateral flexion towards the right, and it did rotation towards the right. So in this time, I'm actually going to be extending him, laterally flexing him away, and trying to rotate him towards the left. Since the muscle's on the right, that will be contralateral. So I'm going to ask permission to go underneath this shoulder, similar to what we've done in the external oblique. Bring his arm out to the side. I'm going to lift up, reach underneath, and cupping onto the glenohumeral joint. With my opposite hand, I'm going to cup the top of the shoulder. So in this case, I need to laterally flex him away from the side I tested. So I'm going to rotate him away. And then I'm going to pick up that shoulder and laterally flex and extend back towards me. So I have rotation to the left. I have extension and lateral flexion to the left. And we're going to bring him back down. So I'm going to go through that one more time, just quickly, just to make sure we've covered our bases here. That was a right internal oblique, which does flexion, lateral flexion, and ipsi rotation. So I need to extend, laterally flex away, and rotate away. So for that, you stand on the same side as the muscle that you're going to be lengthening. You reach across to the opposite shoulder. Cup the shoulders, you laterally flex them away from the muscle, and then you extend and rotate them away from the muscle. So there's all three length actions for internal abdominal oblique, in this case on the right hand side.